to some of the work that we're involved in and why we're doing it, the explanation for why. Yeah, you know, years and years ago, and this is all in the context of the epidemic and crisis we're facing around overdoses, particularly in BIPOC communities. About a decade ago, I was a first responder, I was a firefighter. And as such, I began to notice that there were quite a few individuals we were encountering who were not, let's call them, not the traditional stereotype of who you would encounter in the event of a medical intervention related to overdose. I know even myself, the first time I encountered a young South Asian female who had overdosed, it was really disturbing. It shocked my system. In addition to that, I was also, as you mentioned, I'm also an executive director of a nonprofit. We run a lot of youth programming. And in those youth programs, we started to receive a lot of anecdotal conversations and messages, particularly young, newly married young women who would bring their children in and say, can you please keep an eye on this child today, because they're going through a lot of grief. They've been to counseling. He just lost his father. And the reason I give that example, it was bar none. We were seeing a huge uptick we were seeing it about once a week. I was having these conversations, and it was always a young, newly widowed woman who was bringing her child in saying, his father's gone or her father's gone. So we have a lot of grief in the home. However, that then set the stage for where we are at now. I did not have the luxury, and I think you'll all agree, that we don't have the luxury of waiting for people to get on board, governments to get on board, you know, stakeholders or anybody else to say, you know what, we're vested in your community, or we care about BIPOC communities, so we're going to help you out. I don't have that luxury. These are my community members, young women, young men who are dying, and they were dying in large numbers. So that led to the development of a program. It's called the SALMON Project, which stands for, it's a long one, sorry about this, South Asian Local Mobilization Outreach Network. And the idea, and Aiden was talking about it earlier, the importance of lived experience. We believe in lived experience peers to make sure that if we are carrying message to the community, we got to make sure that it's the people who have the lived experience who are carrying that message forward, who are engaging with the community. You know, someone like me can just sit there and spouting sciencey jargon all day long. It won't really lead to much. You really need the people who have walked the walk to lead the message to the community, especially a community that's newly encountering challenges. And with those challenges comes heavy cultural barriers, stigma. And so we have that project. That project's been in the works now for over a year. It's going really well. We are partnered with, there's a group as well. It's led by Gurkirit Singh, and they do wonderful, wonderful work. Theirs is a volunteer group who goes out and talks to the community about harm reduction, about overdose. So the two things complement each other really well. And as I said, the SALMON Project is grounded in lived experience peers. And one thing that was really important to us too, oftentimes in our community, the female voice is neglected. And you can imagine how hard it is when it comes to reducing stigma around overdose. So I feel very thankful that we do have, I believe at the moment now, 4 strong female peers who were brave and courageous enough to share their story with the community. Now that I did feel like that was good. It's great work, but I did feel like there was a component that was missing, and that led to the development of the Overdose Intervention App. The Overdose Intervention App, what it does, it's, you know, aside from all the fancy technical stuff, you know, it has an inbuilt 911 calling feature, allows you to identify an overdose. It guides you through first aid response, as well as how to administer naloxone. And it does so in multiple languages. So if you are, for example, Punjabi, you can just switch over and you can use it in Punjabi. We did community consultation, and we're very fortunate because I do work at the grassroots level. We did hundreds and hundreds of interviews of individuals and surveys to find out exactly if we are to create this. And mind you, when I say create this, this is all in kind. There's no supports. There's very little, there actually is no financial support. This is all, it's 100% from the community for the community. And so what happened is, and you can see it up here on your screen, thank you very much. Those consultations revealed to us that people in the community, they really did not, there was a few key things that they did not want, and some things they did want. Our first ask was, did you want this to be, for example, if you are a drug user or someone who has substance use challenges now or in the past? And we were asking peers that question, and those peers who were South Asian said, absolutely not. We don't even have access to cell phones, and when we do, sometimes we don't have Wi-Fi, and when we have Wi-Fi and we are about to use, the last thing we're thinking of is going into our phone and pulling up your app. And so our lens shifted to when the community responded and said, we need to be empowered. We need to have the information in our hands. We all have phones. You know, the individuals who are dying, those are our loved ones. They are the ones who, you know, perhaps have come off a long shift. They're laying around at home, and I don't know what's going on. I don't know how to identify an overdose, for example. And the things that exist out there, they're not meant for me. You know, we are the most impacted, BIPOC communities in general, when it comes to overdose, but we have the least amount of resources directed at us. And so that's why this project was done. And like I said, it had to be done in kind. And so those are some of the feedback. So they also did not want any kind of data collection. They wanted no tracking. So the app does not do that. It's absolutely free on multiple platforms. As I mentioned, it has multiple languages. But like I said, you know, technology is wonderful, but really what it's doing, when you place this in somebody's hand, it's reducing stigma. It's reducing those barriers that we have in communities. So you can imagine an elderly senior citizen who has a cell phone, downloads this app, has it on their phone, and then goes and talks to a loved one, a grandchild or a son, and says, hey, look, I have this on my phone. Let's talk about, like, can you explain to me how to use it? So simply going through the app step by step is an exercise in reducing stigma. And we've had very positive results and feedback from community that they're having conversations that they were unable to have before. And so our goal is this unfortunately ever increasing number of overdoses that we're seeing in the community, that we can reduce those, and we can reduce them by engaging the entire community to get on board with responding to overdoses. And that hasn't been done before.